Morning. Let's let that rest for a little bit. What's going on, everybody? It's your main man, Big Eye, the talking to tell, Mr. DTVCH.com, Mr. Positivity. It's another night of being quarantined in the crib, and I know you guys and gals are probably going through. Especially, I can't wait to get to the barber, and I know you can't wait to get out yourself. I actually got a friend of mine that we were talking today about, the coronavirus, and how its impact, from small businesses to people in the medical field, right? So it was just a crazy conversation. The facts that she gave me. Her name is Nurse Monica Scott. She's a RN and a MSN, and we were just busting it up, and it was just crazy. Monica, what's up? How's everything?
What's up, Ivan? Everything is good.
That
Everything
that,
is good.
that was a crazy conversation we had
Conversation. I
about
know.
it's so you've been a nurse for what, 20 years?
A little less than that, but I'm getting there.
You're getting there where you're
Couple more years.
so I'll let you tell people who you are and your profession and all your accolades and all that great stuff. All right.
All right.
All
Well,
right.
been a nurse, I guess about 17, 18 years now. Um, really highly in nurse education, but have worked in all different areas of nursing, from working at the prison to working in home care, working at the schools, nursing homes, in behavioral health. So that's what I'm currently doing now and still doing my nursing education. So just have a lot of background in this field. And now with this whole corona pandemic, it kind of brings a lot of, concerns. And it definitely opened up my eyes to a lot of things that's going on currently, in all of our communities nationally. So,
What as being a nurse and being in the field, what type of things have you seen that you know is like really blowing your mind right now?
I mean, at the end of the day, we have a growing healthcare demand. So we have like the baby boomers are there's about 75 million of them. And then the millennials, there's going to be there's like 83 million of them.
Right.
So the growing healthcare demand is just there.
Right.
And then we have this growing physicians shortage, but it's not only the physicians, it's just all healthcare
Right.
professions, including nursing. So, in particular, I'm looking at the more of the foreign doctors, the
Right.
foreigners.
Right.
Um, you know, it's crazy because by 2030, there's going to be like about they're estimating about 40,000 to 100,000 physician shortage, which is
Wow.
a major concern. Then we have this coronavirus pandemic that just added more to, what we already have issues with.
Right.
Um, and, you know, we have shortage with PPEs, there's just so much going on. We have nurses who are making huge decisions to walk out because they're not being protected.
Yeah, I
And
saw that.
that's hard. Like that I'm telling you now, to make that decision,
Hmm.
we already have that caring, we want to take care of patients. By
You
no
signed
means
up
do
for
we
this.
want to,
This
we signed
we
up for
stuff
it.
you
Like,
signed up.
we don't
Yeah.
want to walk away from them,
Right.
like, at all. So, but sometimes you have to decide, I'm putting myself at in a harm's way.
Right.
And if I can't be protected and I'm going to get sick, then how am I going to continue to take care of patients?
Right. Right.
I can't. I'm sick. I'm down. So it's tough because there's a lot of discussion about whether this is a droplet precaution or airborne precaution, which makes a big difference on
Okay.
what PPE you're going to use.
Right.
You can use a surgical mask if it's a droplet precautions because they're huge. They're
Right.
not going to get through that material.
Right.
But if it's airborne, those surgical mask, that's not safe.
Right.
So, it's kind of like now you're giving different information. Honestly, we don't know what we got going on. So
Right.
it's kind of like, it's better to be safe than having these people who have decided to be in the front line and continue to take care of patients to just be safe,
Right. Yeah.
so and then we go back to this we go back to the foreign doctors and this corona pandemic. They're
Yeah.
being affected major,
Right.
major.
Right.
And I know we had to talk about
Yeah,
that.
and
So
it's so when she's talking about major, we're talking about that if one of these doctors get the virus and passes away, that their whole family has to be deported back to their country, right?
exactly. So you think about it. If you're a physician or even a nurse, whatever, and you're taking care of these patients, and you're like, all right, I might get sick or whatever. I'm American. I could stay home and
Right.
I could go back to work. These doctors not only have to worry about them being at risk of getting this virus, but they also have to think about, well, if I die, what happens to my family? If I get sick and can't work, I have to go back. So their visa status changes.
Right.
So they have that. Now they have the anxiety. They have nightmares about this. They are so concerned. I see this myself where the doctors are talking to me about this and like they're really scared. Listen, by all means, they will take care of patients,
Right.
but they're putting themselves at risk of the
Right.
possibility of them either getting ill, not being able to work, and leaving, because if they don't work, they got to go, or them passing away and their whole family has to leave immediately. Because remember, they're
Damn.
actually yeah, oh yeah, serious.
So
A lot
so
of fear.
so so wait a minute. Let's get this right because I want to make sure everyone hears that. Here it is. That if something was to happen to these doctors and they pass away, they gotta go. Their
They
whole
gotta
family
go.
gotta go. And a lot of the doctors that you spoke to been here for years.
Oh yeah, 2020. Because see, the thing is that right now they're on backlog, meaning
Hmm.
that they could be waiting 50 to 100 years of actually getting permanent residence. So these doctors they don't ever feel like they have, they could be comfortable like
Right.
us. You know what I mean?
Right.
So they feel being deported constantly on a day to day, day in, day out. And when they have families, that makes it worse because some of the kids, they come here when they're so young and they're here. They graduated from high school. They've been here for years and they're very Americanized. So
Right.
when you talk about a family, when a foreign doctor on a non-immigrant visa status dies here, everybody has to go. And they don't have long to go.
But
So they have, most of them have big, they have houses,
right.
their status is very, they make pretty good money. They're not in any type of, financial struggle in that
Right.
sense when they are, but they have to get up and they have to go.
And we're not just talking about doctors. We're talking about
The
anyone
family.
in the healthcare field. Now,
Oh yeah. Hmm.
if this and we talk about they're scared to go to work. Some of them just are like tucked away right now, waiting for this thing to just pan out, wait for the
Well,
dust
see,
to settle.
they can't, that's the thing. They're not, they're doing telework. Because
Well,
remember, if they
yeah,
don't
yeah,
work,
yeah. They're doing telework, and
hmm
let's talk about. I can only imagine the effect that that can take place in Wilmington, not just surrounding areas, but what happens to the Wilmington and the people of Wilmington when what is it 30-40% of the doctors are from another country?
So currently we have about 23%. So one out of, so let me put it simple, very simplistic for you. One out of every four doctors are in the United States who are actually born in another country.
Okay.
So not only are they born in another country, remember when they come here, they actually, so they come to the United States to get like training after their residency ends, right?
Right.
So when their residency ends, they go home. So there's a couple of ways that this happens. They go home for 2 years, right?
Mm-hmm.
Before they can reapply for another visa or green card, right?
Right.
Or they have what's called a Conrad 30 program, which allows them to stay if they agree to practice in an underserved or rural area for 3 years, and then they continue to do it. I mean, because honestly, to get their stuff renewed, that's where they have to practice in those areas.
Right.
Um, so with that being said, you have these physicians that actually serve, a lot of them just serve the underserved.
Right.
Okay. So actively, let's say, so this is the research that I found. So we have 23% of our physicians are actually foreigners. Okay.
Okay.
So from 2010, we had about 188,000. And now 2016, there's 216,000. So that was about a 15% increase. So imagine, okay, if national, like in this country, if we were to lose those doctors in these underserved areas,
Mm-hmm.
who's going to be there to take care of them?
What? Yeah. Exactly.
I don't know.
Exactly.
So now we take Wilmington, okay, so up north, Wilmington area, and not only that, Sussex County
Mm-hmm.
is another county that's affected because of the baby boomers, 65 and older. That's a rural area.
Right.
So there and up north is affected. So if we take Wilmington, and the majority of those doctors are foreigners, we take them away. Who's going to take care of these people?
Wow.
I don't know. And we already have issues with, healthcare,
Right.
just for them to have access to it.
Right.
And these doctors literally are here, and that is pretty much primarily where they practice.
Right. Right. So the doctors that you speak to, and what do they want right now? What if they had a chance to speak to, say, the governor, senators? What do they? What would they? And I got to get them on. I got to get them
Oh yeah,
on.
definitely. I mean, because they could explain so much more because they're living it,
Yeah.
And I was oblivious, and I definitely was ignorant to the fact that I didn't know that they were going through all of this
Mhm.
until speaking to one of the doctors, and I was floored. I was like, wait a minute, what? And then it just got me thinking, like, well, hold on, let me just look up the statistics, and then I'm like, wow, you know what? You're right. The majority of our physicians just in the inner cities are foreigners, and if
Yeah.
they were to, UK is making it so easy for them to go. So people need to understand what some of these doctors are already doctors in their country.
Hmm.
The United States, if they want to come here, there's such a long, huge, crazy process for them to go through. They have to go through training again. They have to go through residency again. So they're like, some of them, we can actually bring more physicians over here or more healthcare providers here if we were to look at our laws and
Hmm.
regulations and things like that, our policies, because who, if I'm already a doctor and I've been practicing 15 years, let's just say, and
Right.
I want to come to America because I want to live the American dream, right?
Right.
They would have to go through that whole entire process. Would you want to go through all of that again? Not me.
Wow.
Like, not me.
Wow.
So the UK is making it so much, even Canada, to say, hey, if you have this training, if you've been doing this is your specialty, then you know what? Come on.
Right.
You don't
Right.
have to go through all of that.
Wow.
So how are we attracted? How are we going to keep them?
Right. Right.
You know what I mean? And a lot of them are kind of like, do I just go back home? Because honestly, they don't get anything. They benefit nothing for staying here. Nothing. Because number one, they're not getting permanent residency.
Right. Right.
Okay. Two, they don't get retirement. They don't get any, once if they die here, they have to be shipped back to their country because they don't stay here.
It's
So,
it's
it's tough.
it's like everything else. Like, you're good enough to work here, but don't get comfortable.
And they never get comfortable because they know that if they were to get ill or if they're not needed, or if, like, right now,
Damn.
I don't know if in July they're supposed to have the the medical students who are done med school, they go to residency. So there's about more than 4,000 currently foreign doctors who have been chosen to do the medical residency here in America. So it has actually I think is the um, they have pretty much stopped the process. It's on hold right now. And right now with this pandemic, it's not the time to be creating a already, physician shortage.
Hmm.
You know, how do it's not going to be easy to replace over 4,000 med
Right,
school grads.
right,
They
right,
work at our underserved
right.
rural population hospitals.
So when you have these doctors, this and medical professionals that are now gone, and I need people to understand like what happens when the people in the community cannot get served. Like it affects everything,
Everything.
everything,
Yeah, people will get
everything, and
sick.
yeah,
There's no everything is going to be affected. Everything. I
everything.
mean, you get sick, then you stop working. There's
Yep.
more disability. There's so many things that it'd affect our community tremendously. And back to the question you had asked on what do they want. I'm sure, and you speak to these doctors, they will tell you, to at least get them, expedite some type of permanent citizenship. You
Right.
know, um,
Right.
Also, they have some of these foreigners have contracts with the employers, so they kind of are like their sponsors.
Right.
And their contracts are not the best either. So kind of like helping them, use different, terminology or
Right.
different things that we use, like when we go on strike or if we ask, when teachers say, "Hey, I demand this, but these benefits and this," they don't they can't do that. It's sad. You
Right.
know what I mean? So they don't have all the options we have. But I know they want to feel comfortable. They want to feel like they belong. They're here. They're helping. They're putting themselves at risk and their family at risk of, not being here, you know, especially at this time because right now they're highly at risk of their visa status changing. You know what I mean? So they're very fearful. And it's just, I don't know, hopefully, there is currently something out in the, in, what is it? I'm just drew a blank here.
No, don't worry.
There's Fairness for High Skill Immigration Act. So there's an act out there that that hopefully we can get people out there to really sign it, get Congress to pass it, because
Mhm.
this will help skilled, highly skilled, necessary healthcare providers. Because it's
Right.
not only them. There's a couple of, I think IT is another one
Hmm.
that will be part of that act, but because remember also the visa stuff is a lottery too.
Right.
So
Right.
it's not only that you're a physician, you're going to come. It's not
Yeah.
like that. I think they get like 30 a year per state,
Yeah.
and
Yeah.
that's it. So that's why it's called the Combat 30 program. But it's tough, man. And I'm telling you, if we don't help and kind of stand with them
Yeah.
and make some changes, it's going to affect us at the end of the day anyway.
One more time for the people that just came in. This is Nurse Monica, and we're talking about the foreign medical professionals that if they die from COVID-19, their families will be deported back to their country. So when that happens, again, Monica, just tell them what happens to Wilmington if that happens, if we start losing foreign medical professionals.
We're not these our the people in the community won't have these doctors. They won't have the health care they need, and a lot of them, we think about it. They have chronic illnesses. Who are they going to see? There's no one for them to see. There's going to be very limited amount of doctors who they will be able to see. They might have to travel far, maybe to Dover, maybe somebody's over there that be able to see them. Well, they already have issues with having access to healthcare, transportation issues. they're going to be sick individuals that's going to affect everything, our entire the economy, everything. So I think this is something that is much serious than I ever can imagine. I just didn't know that these foreign medical professionals are in immigration limbo, especially now,
Yeah, right now. Right now.
right now. So we got to definitely stand up. Um, and because it's like I said, it's a growing healthcare demand right now. And we have a shortage in physicians, we have a shortage in nursing. And I know people will say, well, there's not a shortage in physicians, that we don't need them because we have nurse practitioners and we have PAs and we have, yeah, but look at the specialties they in. Most of the specialties, or most of the areas that these doctors go into, are primary care physicians.
Right.
We need them. They're the ones who follow. They know these patients,
Right.
and everybody doesn't need a cardiologist. Everybody doesn't need an endocrinologist. Everybody doesn't need a pulmonologist.
Right. Right.
You need a primary care physician, and
Yeah.
and the actual foreign doctors. That's pretty much what they go into. Is that.
Yeah. Well, look, Monica, Nurse Monica, thank you so much. What I'm going to do is we're going to get some of the doctors on this Facebook Live next week. I think we're going to shoot for Monday, so be sure to tune in Monday 7:30. Nurse Monica, thank you for all your information as always. Really, really appreciate you. Anything else you want the people to know?
Yes. We gotta stand up for these folks. Come on, guys.
Yeah.
Listen, I know they're foreigners, but guess what? We need them. They're so important in our community.
We all.
We need them to keep serving.
Yeah. You know what? What's so beautiful about it is like it's a melting pot of people. We all
Oh my
need each
gosh,
other. They
we
need
do.
us.
We
We
need them.
need them. We need white folks. White folks need black folks. This is how we make the world work. You know what I mean?
Absolutely.
Well, so
We need them. We need them. They are putting their lives at risk and they're not benefiting from anything.
yeah, yeah. So, Nurse Monica, look, keep in touch with all the information that you got going on. Really,
Absolutely.
really, really, really appreciate you and everything that you do. This is your main man, Big Ive, detvch.com, Mr. Positivity, just keeping you abreast of what's going on in your neighborhood, right around the corner, and in the state of Delaware, but most of all, the city of Wilmington. So, I'm out. Check the website out, detvch.com. Like, subscribe, follow DETV, and we'll keep you going. All right. Cool.